Distinguished guests, professional colleagues, ladies and gentlemen, it's a real pleasure to be here and to see such enthusiasm for an obviously interesting area of discussion, debate, and hopefully outcomes at the end of the meeting. I think there's a huge amount that we can learn from each other, and I hope we'll take full advantage of the time that we're here together over the next couple of days to really learn from each other. And particularly, I think, having understood something of what's going on here in South Africa, to learn what South Africa can bring to the rest of Africa in terms of the knowledge and expertise that's been built over the years in the whole area of para-professionals. I'm breaking the mold a little bit by having a presentation, but I'm going to go through it very quickly. So just a little bit about GALVmed. GALVmed's a not-for-profit organization focused particularly on the small-scale farmers of Africa and South Asia who have a particular need. And we're involved in developing products which are particularly focused on the needs of those farmers. Well, obviously, if you're developing products, those products need markets. So there's a need to develop the markets and the understanding of the need for animal health products. And those products are typically sold in a regulated environment, so we have to work within the legislation that's applied within the countries that in which we work. Everything we do is through partnerships. Many of our, or several of our partners are here today, and we're funded by the Gates Foundation and the UK Aid, for which we are much appreciative. I think it's an important point to start by saying that, we have to recognize that animal health is a very different model to the model that's in human health. And I don't think governments always recognize that. It's a critical difference which isn't properly recognized, because typically in human health we're talking about public good, whereas very often, at least in animal health, we're talking about a private good, where there's an opportunity for private veterinarians and therefore private paravets to get involved. And what we're looking to do is to find a way to encourage the uptake of animal health products at a fair price, reliably, and of a decent quality. And so what we're doing is looking at business models to try and encourage the uptake of products appropriately. And of course, in everything we do, we rely on suitably qualified local staff to administer those products, which requires a decent local legislation to be put in place, or to be in place, to allow those vets and paravets to administer the products legally. So we need the appropriate regulatory processes, which speaks to the need for good product quality and availability, and an environment that allows properly trained, appropriately qualified professionals, whether they be vets or paravets, to do their job effectively and to be recognized for doing that, which is one of the major problems, I believe, in some of the countries in which we work. And obviously here, this week, we're focusing on the last point there, which is the environment to encourage the availability and training of appropriately qualified personnel. So we all know there's a desperate shortage of vets in the rural areas because of underfunded government services. Often it's unattractive for veterinarians to go into the rural areas as private veterinarians. And honestly, it's questionable whether there'll ever be enough vets to meet the need across Africa. Certainly, there are other areas around the world where, which are truly rural in nature, where vets have been. It's been a struggle to attract vets into the rural areas to get the support to the farmers that's needed. It's critical, I think, as we discussed, that we recognize the need for paravets to be working under the responsibility of veterinarians with a clearly defined set of responsibilities. But I think what we have to decide this week, and hopefully convert into some action plans, is a definition of what that really means in practice and how can it be properly administered. There's a challenge across Africa which we see on a daily basis, which is that in some countries paravets are officially recognized. In some countries they're not recognized at all, and every veterinary intervention needs to be undertaken by a veterinarian. And of course, linked to that is the fact that very often the paravets don't have any formal training that's properly recognized and properly accredited. And I think that, I hope that will become a topic which we discuss a little bit more as we go. Now, you know, at field level, the practical needs are immense. There are plenty of things that we can look towards to being the mechanisms to encourage success. But there are plenty of models out there, and we really need to look at the models that exist and learn from them. You know, how can we stimulate the proper use of paraveterinarians, and through that effect some changes in legislation to get some sort of standardization. I raised the word community animal health workers here probably for the first time this morning. I hope that will become a topic that we spend some time discussing so that we can properly understand the proper roles of vets, paravets, and community animal health workers, because I do believe there's a need for all of those to have their properly defined areas of responsibility. I think we need to talk about what's it going to take to get accredited courses and qualifications in place, and how we then can manage the performance of the paravets and associated community animal health workers. I hope this will be an intensely practical few days that we spend together, and I hope that at the end of it we will come out with things that we can then take back to our national governments, that we can take back as learnings and recommendations, and that which we can force through a consolidated approach with the support of many of the organizations who are here today, whether it be OIE, FAO, AU-IBAR, and so on. We're here all, I hope, with a single common purpose, which is to find a way to make things happen and to bring some progress to the control of livestock disease across Africa. And with that, I wish us all the best for the hopefully challenging and stimulating discussions that we'll have over the days ahead, and I look forward to meeting many more of you as we progress. Thank you very much.